Today we are going to learn about the Healthcare Access and Public Health Initiative, the transformative role of development communication. Access to quality healthcare and effective public health initiatives are fundamental pillars for sustainable development and improving the well-being of communities worldwide. Development communication plays a crucial role in bringing the gap between the healthcare systems and the populations they serve by fostering awareness, promoting health literacy, and encouraging behavioral changes. Through participatory communication strategies, development communication empowers individuals and communities to actively engage with health services, advocate for their rights, and adopt preventive health practices. In this way, healthcare access and public health initiatives become more inclusive, responsive, and impactful, contributing not only to better health outcomes but also to social equity and development progress. Now, healthcare access refers to the ability of individuals to obtain and afford needed medical services. It encompasses multiple dimensions like physical access, proximity of facilities, availability of transport, geographical barriers, especially in rural remote areas, financial affordability, cost of services, medications, diagnostics, and insurance coverage. So, healthcare access is also linked with awareness and acceptability, knowledge of available services, cultural beliefs, stigma, and trust in the healthcare system, and also quality services, competent healthcare professionals, learned doctors, adequate infrastructure, reliable equipment, and ethical practices. So, healthcare access can be understand about the ability of individuals to obtain necessary health services in a timely, affordable, and acceptable manner, with the key components as availability, presence of healthcare facilities, professional medicine and equipment, affordability, and how to access and how to accept it. So, public health initiative focus on a broader population level approach to improving health. They emphasize prevention, means immunization, disease surveillance, and vector control, education and awareness, promoting healthy lifestyle, hygiene, nutritional literacy, infrastructure development, building primary health centers, community health centers, hospitals, sanitation system, and now there is lot of remote hospital services, hospital vans, and जो हम कहते हैं दूर बैठा डॉक्टर भी थ्रू AI टूल्स एंड टेक्निक्स थ्रू इंटरनेट हमारे गांव तक पहुंच जाता है. सो ऑल काइंड ऑफ community participation we need, engaging local communities in health decision making and implementation, policy and regulation, laws related to food safety, environmental health, and drug quality. These kind of public health initiative focus on a broader population level approach to improvement of health. So, in our media practices, what are the pivotal role of our media? Educating masses, translating complex medical information into accessible content for diverse audiences, bridge between policy and citizens, explaining government health schemes, policies, and their impact on the ground. It is very, very important with public announcement or through news reporting, feature writing, or any kind of telecast. This kind of bridging the gap between the policy and citizens is very important, at most important, because lot of below poverty line and the needy people who need the policy, who need that implementation, and who need the benefit of that health inputs. So, reporting inequities, highlighting disparities in healthcare access based on geography, socioeconomic status, gender, caste, or disability. Promoting behavioral change, encouraging adoption of healthy practices like vaccination, hygiene, family planning, and watchdog function investigating corruption also, inefficiencies and failures in healthcare delivery. You have to be, do proper investigating reporting to catch that kind of functions, malpractices. So, role of media in healthcare communication, broadcast media or our print media or our media portals, digital media with its wide reach and immediacy is indispensable for public health communication in a diverse country like India. What are the key features? First of all is the awareness creation. Campaigns for vaccination drivers like Mission Indradhanush, promoting hand hygiene, dengue prevention or understanding symptoms of common disease. केरल में और बहुत सारे राज्यों में जो मिसल रुबेला वैक्सीन है उसमें ये एक मिस इन्फॉर्मेशन फैलाया गया कि ये जो मिसल रुबेला वैक्सीन जो लगवाएगा वो भविष्य में माता पिता नहीं बन पाएगा, जो बच्चे हैं वो नपुंसक हो जाएंगे। इस तरह का मिस कम्युनिकेशन, मिस इन्फॉर्मेशन अबाउट द वैक्सीनेशन, our social media and our other kind of malpractices are being disseminated. So please stop this kind of anti-science communication through our social media. Countering misinformation, disinformation, actively debunking health myths and fake news, particularly critical during pandemics like COVID-19 infodemics. Lot of, infodemic is a newly used term, is a information infodemics, यानी सूचनाओं की महामारी। कोविड-19 में इतना गलत सूचनाएं फैली कि उसको जो WHO के DG हैं उन्होंने वो टर्म दिया and it is now well known as infodemic. So we are talking pandemic, epidemic and also infodemic during COVID-19. So, role of media in healthcare communication, showcasing successful models, featuring positive stories of community health initiative, innovative healthcare delivery or effective implementation of government schemes, investigating health policy failures, holding authorities accountable for issues like drug stockouts, poor infrastructure, lack of staff or fund mismanagement. किन अस्पतालों में दवाइयाँ नहीं पहुँच रही हैं, कहाँ पर एक जो गरीब आदमी है उसको दवाइयाँ समय से नहीं मिल पाती हैं, डॉक्टर्स उपलब्ध नहीं हैं, all kind of investigation must be planned. Role of media is also in advocacy, giving voice to patient grievances, advocating for better policies and pushing for systematic reforms, humanizing health stories, presenting health challenges and triumphs through personal narratives to build empathy and understanding. Documentaries in-depth exploration of specific health challenge like TB crisis, maternal mortality in remote areas, or the impact of a health initiative. Radio campaigns can be planned with short jingles, drama series, talk shows, or question answer sessions on Akashvani and community radio, leveraging their reach in rural areas. News bulletins and special reports can be planned with regular updates on disease outbreaks, health advisories, policy announcement, and investigative pieces. Public service announcements plays crucial role during any kind of crisis. Concise, impactful messages designed for broad dissemination, often using celebrity endorsements or compelling visual or audio. Talk show and debates, facilitating discussions between health experts, policymakers, and citizens to critical health issues. Podcast and reels, new media, short engaging digital content for health explainers, myth busting and personal health narrative targeting younger digitally native audiences. Mobile first content, optimized short videos and infographic for quick consumption on smartphones, essential in India's mobile dominant media landscape. And these are the major government initiatives in India under the Healthcare Access and Public Health Initiative. Ayushman Bharat, it is known as PM Jai Yojana, and objective are universal health coverage. Key features, it is free health insurance, provide free health insurance up to 5 lakh per family per year. Mission Health, National Health Mission NHM, improve rural health infrastructure, and key features are ASHA workers, RMNCH plus A outreach programs are the key features of this National Health Mission. Mission Indradhanush is the full immunization coverage, focus on children and pregnant women. E-Sanjeevani is a telemedicine, is a very needful in today's India's rural population. Doctor in the city or any district can be reached through telephonically or through internet to the remote areas and can prescribe the medicine or the proper treatment, and over 14 crores consultations as of 2024. It is to be noted, over 14 crores consultations has been done. It is a big number. Poshan Abhiyan, nutritional outcomes, it fulfill the objective of nutrition and targets stunting, wasting and anemia. जो बच्चे कमज़ोर हैं, उनका कद नहीं बढ़ पा रहा है, उनमें वो एनीमिक हो रहे हैं, वो माताएं और वो बच्चे, उनके लिए ये पोषण अभियान के नाम से शुरू किया गया है. नेशनल डिजिटल हेल्थ मिशन NDHM is based on health IDs and digital records. Another important issue, because we need digital records of our population, of our citizens, to know about their health, what kind of disease they had earlier in the 10 years back, what kind of including their blood, including the disease and their all kind of information must be at one place, and any doctor, any medical agency can be checked anytime through this record. Is a very welcome step of the government, and key features are interoperable digital health ecosystem. Now, we will discuss some few case studies like ASHA workers and COVID-19 response under this National Health Mission. ASHAs were frontier or frontline warriors, door-to-door surveillance, contact tracing, disseminating quarantine information, dispelling myths and vaccine counseling. Their ability to build trust in communities was invaluable. And what is the impact? Crucial in controlling spread, improving vaccination rates and providing primary care, especially in rural belts. Media coverage. Media channels have extensively featured ASHAs, highlighting their dedication, the risk they faced and the systematic challenge, low pay, lack of protection they often endured. This reporting brought their invisible labor to the forefront. Now, Kumbh Mela 2019 Public Health Coordination, organized sanitation, and in 2024 we also observed the Kumbh Mela and the beautifully coordination about the public health and massive effort for toilet waste disposal and robust disease surveillance systems to prevent outbreak among millions of pilgrims. And what is the role of media? Doordarshan and Akashvani played a crucial role by airing regular health public service announcement, hygiene, safe drinking water, avoiding overcrowding and health advisories before and during the Kumbh Melas. The preemptive communication was vital for public safety. Araku Valley, Andhra Pradesh, community radio for tribal health. Another case study I am presenting here. Community radio, and they are known as Radio Kotagiri and Radio Dhimsa, proved highly effective due to its local language, accessibility, and community ownership. Program specifically addressed maternal health, TB, and anemia awareness, tailoring content to be cultural context and specific health challenges of tribal groups. And what was the result? Increased health seeking behavior among women, greater understanding of symptoms, and reduced stigma, demonstrating the power of culturally relevant local media. TB reporting by the Wire, India is spent, and Gaon Connection. Another case study I am presenting, this digital media platform moved beyond basic news to cover systematic issue like drug stockouts, patient stigmatization, inadequate infrastructure, and the challenges faced by TB patients, particularly from marginalized communities. These investigative pieces often exposed gaps in government programs, giving voices to patients and advocating for better implementation and accountability. This is a strong example of watchdog journalism impacting public health policy. Media organization involved in healthcare accesses, as we already talked about, the India spent data journalism platform providing in-depth evidence-based reports on health, sanitation, and social development. Gaon Connection is another India's largest rural media platform covering health and development issues for rural perspective, and Better India focuses on positive stories of change and innovation in health. Swasth Digital Health Foundation works towards digital health equity. Khabar Lehriya is another Chambal Media, popularly known as Chambal Media, pioneering women-led rural media organization that often covers public health issues, and Public Health Foundation of India, PHFI, academic and research institute that provide data and policy recommendations. Lot of and these are the international organizations like WHO. Sets global health standard, provide technical guidance, support health system strengthening, and leads campaigns like polio eradication, COVID-19 responses in India, a crucial source of global health perspective and data. BBC Media Action is another international group, implements media and communication campaigns for development, including extensive work on health communication in India through radio, television, dramas, and digital platform. Bill and Melinda Gates Foundation is another platform for major funding on health initiative, and WASH program for vaccination, maternal and child health, and water, sanitation, and hygiene. And MSF Doctors Without Borders in another platform provide emergency medical aid in conflict zones. UNICEF focuses on material and child healthcare program. Global Health Media Project, another organization, creates high quality animated health videos for low resources areas. So now we'll discuss about the role of Doordarshan and Akashvani. Historically, the backbone of public health communication in India. Regular public service announcements on tuberculosis, COVID-19 protocols, family planning, and polio eradication. All India Radio rural radio series on maternal health, child nutrition, and hygiene, often using local dialects and folk formats. The importance of extensive reach, public trust, and localized content. So, a lot of YouTube platform like India Can Eliminate TB by 2025. This is a beautiful documentary in a resolute stride towards achieving the sustainable development goal of eliminating tuberculosis worldwide by 2030. India has set an even more ambitious target of accomplishing this feat by 2025. While India remains the largest contributor to global TB cases, encouragingly, the nation has witnessed a notable decline in the number of cases reported in 2021. in-depth storytelling, and bringing human faces to health statistics is the learning from these media coverages. So, what are the challenges in health communication for broadcast media, or we can say digital media? Health illiteracy. High level of health illiteracy, especially in remote rural India, make it challenging to communicate complex medical information simply and accurately. Language and dialect barriers. India's linguistic diversity necessitates content localized and translation, which can be resource intensive. Stigma around diseases. Deep seated social stigma around disease like TB, HIV, mental health issues, or even reproductive health can hinder open communication and health seeking behavior. Fake news and health misinformation is a crucial issue and is a major challenge in health communication for any media. The rapid spread of unverified information, particularly on social media, poses a significant threat to public health, and broadcast media particularly has a crucial role in countering this infodemic. A limited specialized health journalist is another challenge in our media house, because we have lot of experts journalists in politics, sports, share market and other fields, but we have very less population of journalists or reporters who are specialized in health and science issues. So, lack of professionally trained full-time health beat journalists in regional media houses often lead to inaccurate, sensational or superficial reporting. We have to think on that. Our media system, our media houses must recruit, must train their journalists in terms of health, environment and science reporting. Pressure for spread and sensationalism. The competitive media environment can prioritize breaking news and sensational headlines over nuanced, evidence based health reporting. We have to be careful, because we are reporting for our citizens, for our audiences. They need a media support, they need the true information, they need the information about the medical services provided by the government or provided by in the city in that particular region. So, no need to sensitize or just to say sake for speed, and you must learn about the speed with accuracy, and this is the expertise which is required, which is the need of the hour. That kind of expertise of health and science reporting is required in Indian media scenario or Indian media systems. Funding and resources. Insufficient resources for in-depth investigative health journalism, leading to reliance on official resources. Access to reliable data. Challenges in obtaining accurate, real-time, disaggregated health data from public system. This is another challenge, and for this our health indicators, our health offices, our health ministries and departments must provide correct data on time on their websites or other public platform, and it will help our citizens and media on time to access them and to provide the true picture before the audience. So, emerging trends in health journalism. Digital storytelling in health, it is utmost important. You must inform your audience with various stories, with various different parameters, what kind of government initiative, what kind of non-government initiative, what international organizations are doing for your health. AI and health journalism is very important aspect. lot of our startups, health-based startups, are doing telemedicine, and they are taking help with artificial intelligence, and they provide one time, one citizen has to pay for some small amount for whole year, and lot of startups are there. They are carrying them throughout the year for their individual and their family with the various help with the AI tools and technique to get access to doctors and medicine to the remote areas. Data journalism in healthcare is another important thing, because lot of data is available for all the disease, for all the medicine, for all the healthcare professional, for the hospital, for the government initiative. So, lot of data is available for journalism. So, you must provide data in healthcare on time. Citizen journalist in local health issues. Solution based journalism. What kind of health solution are being provided by the government or by the other institutions? You must disseminate the solutions of the health problem. Trauma informed reporting and personalized health content are the other engaging trends in health journalism. So, this is all about for today's session. थैंक यू वेरी मच फॉर योर अटेंशन. मिलेंगे अगले एपिसोड में. नमस्कार.